Good evening,
Hello,
and welcome to tonight's live telephone town hall with Congresswoman Rosa DeLauro, your representative for the 3rd District of Connecticut. My name is Tim Andrews, and I'll be moderating the conversation tonight. And in a few moments, we'll be joined by the Congresswoman. But before we begin, I'd like to explain what's going to happen in the next hour. The purpose of this call is to hear from you and provide updates on Medicare and health insurance open enrollment, which are both currently ongoing. We'll be joined by Judy Stein, Executive Director of the Center for Medicare Advocacy, as well as Sean King, Acting Healthcare Advocate for the state of Connecticut and former General Counsel for the Office of the Healthcare Advocate. We'll also be asking poll questions this evening so that we can hear from everyone in the audience and get your opinions. If you're on the phone, you can vote by pressing the corresponding number on your keypad, which I'll explain more later. And if you're online, you can vote by selecting your response right below the streaming player. If at any point during tonight's call you'd like to ask Congresswoman DeLauro or our guest speakers a question, simply press *3 on your telephone keypad. Again, just press *3. You will continue to hear the town hall until one of the Congresswoman's staff members can assist you. Now, if you're streaming the event on our website, you can simply type your name and question right below the streaming player. Also, want to remind you, if you would like to sign up for our newsletter to stay informed with everything that's going on with the Congresswoman, just press *6 at any time, and we will collect your email address. Now, if we're unable to answer your specific questions during tonight's call, please note that you'll be able to leave a voicemail for the Congresswoman and her staff at the end of the call simply by remaining on the line. And with that, please welcome Congresswoman DeLauro. Congresswoman, thank you for joining us.
Thank you so much, Tim, and hello, everyone. This is Congresswoman Rosa DeLauro. I represent Connecticut's 3rd Congressional District, and let me just say thank you to all of you for joining tonight's live Tele-Townhall meeting. Purpose of the call, first and foremost, is hearing from you and being able to answer your questions. So I want to introduce our guests tonight. I'm very, very excited about our guests, real experts in the field here. Since 1986, Judy Stein has been the Executive Director of the Center for Medicare Advocacy, which she also founded. Such a champion for seniors and people with disabilities since the very beginning of her legal career. I've worked closely with Judy. I'm so grateful to her on all of the issues that we have worked on that have impacted Medicare and seniors, especially in exposing Medicare Advantage for the disadvantage that it is. To be very honest with you, I don't do a meeting or a briefing on Medicare where Judy is not there, and I'll postpone it until I can get her to be a part of it. Sean King, recently named the Acting Healthcare Advocate for the state of Connecticut. He served as the General Counsel for the Office of the Healthcare Advocate. Lucky to have such an advocate for all of us, and this office to help assist consumers in making informed decisions when selecting a health plan. They can also work with consumers to resolve problems with health insurance plans, whether it's about prior authorization issues, claims, denials, or billing questions. So thank you so much for taking the time to join with all of us tonight. Eager to take your questions.
Thank you, Rosa. Thank you.
Thanks. We're eager to take your questions. Let's just say a few words about Medicare and health insurance, the marketplace open enrollment. Starting with Medicare, from now until December 7th, you can make changes to your coverage options. For 2024, the standard monthly Part B premium will be $174.70. It's an increase of $9.80 per month. The annual Part B deductible will increase to $240, an increase of $14. For 2024, the base premium for a Medicare Part D prescription drug plan will be $34.70 a month. It's up by $1.96 a month. From now until January 15th, consumers can sign up for a marketplace plan during open enrollment. Consumers who enroll by midnight, December 15th, that's 5 a.m. Eastern Standard Time on December 16th, you can get a full year coverage that starts January 1st, 2024. For individual insurance market rate, premiums will increase by an average of 9.4%. Similarly, the small group insurance market premium will increase by about 7.4%. Health insurance premiums are affected by several key factors. Medical costs have surged by 7 to 9%, and prescription expenses have risen by approximately 11 to 19%. Let me talk about how the Inflation Reduction Act helps. The Affordable Care Act. The Inflation Reduction Act ensures that no individual or family will pay more than 8.5% of their income on health insurance premiums, even if they make more than 400% of the federal poverty level. Before the American Rescue Plan and the Inflation Reduction Act, if you were a family of 4 in need of coverage and you made $1 over the income limit of $120,000, you were not eligible for any subsidies. This opportunity can result in thousands of dollars in savings for families because they are now eligible. They are now eligible. I'm going to repeat it again. You're now eligible for a subsidy. Let me mention Medicare briefly. The Inflation Reduction Act implemented the $35 cap on insulin, which has already helped more than 34,000 seniors in Connecticut. I strongly believe this price cap should apply to all insurance. We are in the start of the flu season. The law also ensures that there is no cost for vaccines for more than 57,000 seniors in Connecticut. This includes the shingles and the RSV vaccine. In 2024, Medicare Part D plans will cover an additional $370 in drug costs before people reach the donut hole, which is $5,030. And a reminder, and I wish it were sooner, but it will be in 2025 when the $2,000 out-of-pocket cap takes effect. So we're 2 years away. The Inflation Reduction Act is also ensuring that Part D average premiums increase by no more than 6% from the previous year. Individuals with Part D coverage who have low income will be eligible for extra help. That's a program, the Extra Help Program, if you make less than $21,970 a year. They will pay a low or no premium at all for their Part D plan and will have a zero deductible. And Medicare Part D drug price negotiations are underway, something I have long supported, and I wish the prices were taking effect sooner than 2026. But it is a critical first a step, considering Big Pharma has fought and lobbied and negotiated against this change, and they fought tooth and nail. So thanks for participating. I hope you find the discussion useful. Before I turn this thing over to our guests, remind everyone, if you want to ask a question, please press *3 at any moment, which will place you in the queue to be able to ask a question. Let me now turn it over to Judy and to Sean, who will say a few words, and then we'll take questions. Judy, and then Sean. Judy, go for it.
Thank you so much. It's good to hear your voice, Representative. It's great to be talking with you and with Sean and with all who are joining us from the 3rd District. I want people to know that the Center for Medicare Advocacy is available to help them if they are Connecticut residents at no cost when they have questions, concerns about Medicare during any time during the course of the year. You can reach us at 800-262-4414, 800-262-4414. And you can also find a huge array of information on our website, medicareadvocacy.org. We have a real live human being who answers the phone every day, not an answering machine. And you can also find us at 860-456-7790. We are a unique organization located in Connecticut that serves the whole state. And we also bring policy concerns and questions to champions like Rosa DeLauro and others in Congress to help make Medicare better for everybody. Right now, as you probably know, and as Rosa just indicated, this is when you can reconsider or consider your Medicare choices for 2024. Between now and December 7th, look to make sure if you are in traditional Medicare that your Part D prescription drug plan is the best for you for 2024, that it will cover your current medications and ones you think you might need for next year. And if if there's covered still, and if the cost for those drugs is something you are likely to be able to afford, because the plans change every year. By the same token, Medicare Advantage, the private Medicare plans that are required sometimes for Medicare for Connecticut state retirees and many teachers, but are optional for other Medicare beneficiaries. Those plans change every year. So if you have the option to see whether you want to stay in a Medicare Advantage plan or not, you should look at what will be available in your Medicare Advantage plan in 2024. The doctors can change, hospitals can change, and they can actually change during the course of the year. Make sure it looks like those will meet your needs. You buy insurance and you have Medicare for when you get sick and if you get injured. Make sure that you can, to the best of your ability, be in the traditional Medicare program with the right prescription drug plan, or if you have Medicare Advantage as your choice, that it meets your needs for the coming year. If you have any questions about this, as I say, we are available at the Center for Medicare Advocacy with any problems that we can help with Medicare, 9 to 5, Monday through Friday. And we are also partnered with the Choices program, which can help you make enrollment decisions for the coming year. Please look at our website, medicareadvocacy.org. Our materials are available most of the time in English and Spanish, and we're available to help Connecticut residents at no cost throughout the state of Connecticut with all your Medicare concerns. Thank you, and I'll turn it back over to you, Rosa. Please contact us if we can help you at the Center for Medicare Advocacy.
Thanks so much. Just dynamite as always. Judy. Sean, you're up.
Thank you, Congresswoman DeLauro, and that's a hard act to follow, the great Judy Stein. I'm a bit humbled to be sharing the stage with both of you. But once again, I'm Sean King. I'm the acting healthcare advocate for the state of Connecticut. The Office of the Healthcare Advocate was established in 1999 as a consumer assistance agency for the state. We are the Connecticut's Consumer Assistance Program, and we are available also free of charge to any Connecticut resident who is having trouble enrolling in a health insurance plan, deciding on a health insurance plan, understanding how their health insurance plan operates. We can also assist. One of our primary functions is to assist consumers who are having difficulty with a particular claim, whether a claim's been denied at the prior authorization level or a claim's been denied after a service has been provided. And you as a consumer are seeking some assistance in addressing that denial, navigating through the administrative appeals process, and hopefully getting that denial overturned so that your insurer will pay for those healthcare services as you anticipated. We work with all forms of health insurance. So we overlap the Center for Medicare Advocacy just a little bit in dealing with some Medicare claims, but we also deal with commercial insurance, insurance through an employer, insurance that one might get through Connecticut's marketplace. We assist people with enrolling in Medicaid, the Husky program in Connecticut, and troubleshooting coverage problems that they have through Medicaid. We assist military members and families with their TRICARE benefits. So any form of health insurance that you might get in Connecticut, we're available to assist, and we're available to help all consumers in Connecticut deal with those issues.
Thank you, Sean, and thank you, Judy, for joining us tonight. And I just want to remind everybody, this is an interactive town hall. We want to hear from you. We want to make sure we get your questions answered. So if you're joining us via telephone this evening, if you'd like to ask a question, simply press *3. And a member of our staff will speak with you. We'll get your name, the area you're calling from, and your question, and you'll be able to ask your question live and directly to our guest speakers or to the Congresswoman. Also, if you're joining us online, you can simply type your name and question right below the streaming player. And again, I want to remind you, if you'd like to stay up to date with everything that's going on with our office, simply press *6, and we'll collect your email to make sure that you get our newsletter. Also, we have some poll questions for you this evening. We'd like to get your opinions, and we're going to ask our first poll question this evening. And it's very simple to participate. If you're on the phone, you can vote by pressing the corresponding number to your answer on your keypad. And if you're online, you'll be able to see that poll right below the streaming player. You can select your response accordingly. Our first poll question this evening: should all prescription drug prices be negotiated, not just in Medicare? Press 1 for yes, press 2 for no. And again, we appreciate your participation. And again, if you have a question that you would like to ask this evening, simply press *3 on your telephone keypad. Congresswoman, our first question this evening is from Jonathan Baird. Hi, Jonathan. Thank you for calling in and holding.
Hi.
What's your question?
Hi, Rosa. Hello. My question, actually, it's a two-pronged question. One, it's a question about Medicare and why are the guidelines for Medicare dictating what all hospitals can do? Because the second part of my question is the elderly were not they're not able to negotiate a lot of the avenues that the hospitals are afraid to step out of their lanes in. And that's been my experience. And when I am in a hospital, just discharged yesterday, and I'm told out of 24 patients on the unit, I was the only one that could advocate for myself. And it was an observation unit. And it was for my heart. I ask this because I know what's going on, and I speak to the staff that's on the floor, and I speak to the staff that's not on the floor, and I was told this by someone, I can't say, otherwise the cat's out of the bag. They told me in their position of power, at least on their unit, and they said to me, you know, it's sad. You don't know the half of what's going on. So if the healthcare professionals and paraprofessionals don't know the rules, and if they do, they can't step outside of their own lane. So how does that make it easier with Medicaid guidelines for the elderly that I know are the majority population, and I know that they're being denied services from Medicare, and they're setting what parameters are approved or not. And quite frankly, it's taken the compassion and the ability for doctors, and it's not recovery because other hospitals like Danbury or Norwalk Hospital, they don't have these issues. And so it's kind of interesting. Inner city, maybe.
Well, Rosa, do you want me to help with that,
yes,
or do you want to proceed?
I'm just going to go right to you, Judy, on this because of the guidelines, but you heard the heartfelt inquiry. So
yes.
Please, Judy, go.
I'll do my best to respond. I think what you're referring to is what's known as observation status in hospitals. And it's not just in one hospital. Any hospital that serves Medicare patients.
I need to interrupt because it's not about the unit itself. It's not about paying that unit. It is staffed with the same amount of staff to patient ratio.
Yes.
It is the same.
That's right.
Everything's the same. So
yes.
So
Why don't you let Judy get a chance to answer, my dear, okay? Give her a chance.
I just know that there is a big problem with what's known as observation status, of whether you're in a unit, so to speak, or not, even though one is getting should be getting the same exact services as are available for people who are considered admitted to the hospital. And this is true in all Medicare, all hospitals that get Medicare funding. And the observations unit or status is dictated by Medicare, not by the hospitals, and they do have to abide by that Medicare rule with regard to observation status. The care should not be different, and the staffing should not be different.
Judy, let me just ask you this, because I guess if people are finding that as a disadvantage, and the gentleman spoke about, people who can't engage or make their voices heard in this effort, that what is the likelihood of any of that, can be effectuated in any way?
Well, certainly, I'm not sure I've gotten to the heart of your question, but there's observation status is a big problem. The Center for Medicare Advocacy has been in court challenging this. Representative Joe Courtney from the 2nd District has, for I think like the 4th Congress, introduced a bill to have all time in the hospital considered inpatient, because it can affect your discharge rights, and it can affect your ability to get nursing home coverage after a hospital stay. So it's very important, as you have been able to advocate for yourself, and it is true that most people don't understand and don't have the wherewithal to question this. That's why we exist. The Center for Medicare Advocacy, 860-456-7790, does handle a lot of hospital and observation in particular issues, and we will advocate on behalf of Medicare beneficiaries from any part of the state who've gotten care in any hospital in the state.
And I'm a co-sponsor of Congressman Courtney's bill.
Yes, of course. Thank you very much.
Thank you, Judy. Next question.
Just to remind everybody, this is an interactive telephone town hall. So if you'd like to ask a question, simply press *3 if you're on the telephone. And if you're joining us online, just type your name and question right below the streaming player. We'll get to as many questions as we can this evening. Up next from Brantford, we have Brenda Bailey. Hi, Brenda. Thank you so much for joining us.
Hello. First, I want to thank you, Rosa. About 2016, you helped me get on disability after being rejected. So I want to thank you for that. But my question is, I came in late on the meeting, and I thought I heard that there's going to be a $2,000 deductible in a couple of years for Medicare.
Yes, it is a cap, and that's in 2025. I'm sorry, I wish there would be an out-of-pocket cap on drugs.
Not a deductible.
Not a deductible. Is that right, Judy? I'm going to be absolutely accurate.
You said it exactly right. The questioner thought it was a deductible. Of course, it's good news for her. I'm sorry to interrupt.
Yes. No, I appreciate the interruption. So that would be, honestly, I'm so sorry that we have to wait so long. I wish it would be sooner, but I'll take it. An out-of-pocket cap on drugs, $2,000. My God, this is, people are just going under from the cost of drugs.
Up next, we have Lynn from Stratford on the line. Thank you for calling in tonight, Lynn, and thank you for holding. Go right ahead.
Yes,
hi, Lynn.
Hello. Hi, Rosa. So what happened is I'm on blood thinner and I'm on Ozempic for diabetes. And every year in April, I go into the donut hall. And so when I go to purchase my Ozempic, it's $453. And my blood thinner is $145. And then I take inhalers and all that. So it comes out to like $600 a month. So I've contacted different offices on how to get help. And the weird thing is, I worked for health insurance for 32 years and retired. But I used to, when I worked, I used to get a $25 coupon, and that's all I paid for my Ozempic. But once you became Medicare eligible, you can't do that anymore because it's considered double dipping. Because it's a federal or government type thing that gives you that card. And but at this point, I have to meet $7,500 out of pocket before they cover me again, and it goes into catastrophic, I believe, and then they cover a certain amount. I never meet that. And then unfortunately, my doctors hardly have the Ozempic in their office, so I don't take it. I take it when I can, but I can't afford that much money a month for my pills, and there's things I don't take, and it kills me because I worked 53 years of my life, and I thought I was going to be okay when I retired, and I can't even afford and I can't get help because I get too much money from my pension and my Social Security, but they don't go by your mortgage, by your bills, It's just unfair.
Yeah. No, it is. I'm going to ask Judy and Sean to comment on this. And let me just ask you: do you have Medicare Advantage? Is this what is your insurance coverage? Is it Medicare Advantage?
It's Medicare Advantage, yes.
Okay, Judy, Sean.
In 2024, there will be good news in that, and I believe that your professional staff, Rosa, would know if I'm getting this wrong, but I think that donut hole is going away this coming year, and so you shouldn't be subject to that large donut hole deductible, but I don't know about your particular Medicare Advantage plan. And I would encourage you to call my office, the Center for Medicare Advocacy, and ask to speak to someone about what will be the Part D cost sharing for 2024, which I believe is changing.
And Judy and Sean, we've actually had several folks ask if you could repeat your contact info. Judy, we'll start with you, and then Sean, if we could get just to repeat and get your contact information out there for the folks that are joining us.
Absolutely. This is Judy Stein. It's called the Center for Medicare Advocacy. Our telephone numbers are toll-free 800-262-4414 or 860-456-7790. Our website is medicareadvocacy.org. medicareadvocacy.org.
Sean?
And Sean?
And this is Sean King, Acting Healthcare Advocate for the state of Connecticut. The Office of the Healthcare Advocate can be reached by toll-free phone number 866-466-4446. There's a lot of repeated numbers in there, so I'll say it again. 866-466-4446. You can also reach us by email at healthcare.advocate@ct.gov. That's healthcare.advocate@ct.gov. You can also reach us through our website at ct.gov/OHA.
Thank you, Sean. Thank you, Judy. And Sean, just a reminder, on any of these questions that come in, feel free to jump in if you have something that you would like to add. And we want to remind everybody that are joining us this evening, if you have a question, this is a great time to get that question answered. Simply press *3 on your telephone keypad. And if you're joining us online, you can type your name and question right below the streaming player. At this point, we would like to ask you another poll question.
Tim,
another
hold
poll
on.
question this evening, and it's very easy to respond to this poll question. If you're joining us on phone, you can just press the corresponding number on your keypad to your answer, and if you're joining us online, you can just type in your answer right below the streaming player. So the second question this evening, should dental, vision, and hearing be included in Medicare? Press 1 for yes, press 2 for no. Again, should dental, vision, and hearing be included in Medicare? Press 1 for yes and press 2 for no. We appreciate you participating tonight.
Okay.
We want to hear from you.
Sean, can I ask you if you had a comment about the last question, which had to do with the donut hole, et cetera? It's my understanding that this is narrowing, and I'll double check the absolute date, Judy. I think it narrows in.
I have found it. It's January 1st, and it will be essentially a $3,250 cap in 2024 for Part D. The catastrophic coverage donut hole copay will go away during 2024.
Okay. Thank you. Sean, do you have anything to add here?
I will just defer to Judy's expertise on that particular point, but also to reiterate something she mentioned at the outset was whether it's Ozempic or any other drug, to make sure that you are comparing drug plans or Medicare Advantage plans for next year to see if there are those changes in the drugs in the formulary for that particular plan, not just whether a drug is on or off the formulary, but pay attention to the placement, what tier placement that drug is going to be on, because that can affect your out-of-pocket costs as well year over year.
Thank you.
Thank you, Sean. Up next, we have another call coming in. Congresswoman, our next guest is Betsy Wingate. Hi, Betsy. Thank you for joining us tonight.
Thank you, Betsy.
Hi, how are you? Hi, Congress DeLauro. It's nice talking to you. I was on the last meeting, and I'm not asking the question about anything with Medicare, which I do have some points about it, but I was on the last time discussing the Connecticut paid leave, where I was having issues. I was out of work for a whole week in November of 22, and the issue is my doctor filled out everything. I sent everything to my employer, and my employer is supposed to fill it out and send it to Connecticut paid leave so they can pay me to verify that I work. And that has not been done yet. And you had me to speak to someone from Connecticut paid leave, and they said they would reach out to me, and nobody ever did. When I called them, they said they have no knowledge of what I was talking about and that I was denied because all the paperwork hadn't been sent in, which I mailed in. I sent everything. I faxed everything into my company, and every time I call the employer, and they say, oh, we're going to get right to it. I'm doing this and I'm doing that, and I'll make sure I get it done. And I've talked to them several times, and actually I just talked to them maybe about a month ago about it now, and they said, oh, I'm going to see it in my pay stub where we have on our thing, and they still not even sent that paperwork out. So I'm saying, is there a better way that we can have this system when people are getting and you waiting on somebody that's holding up money that you need that you missed out on?
Let me do this, and I'm going to have my office make the inquiries for you, Betsy. This is our phone number. It's 203-562-3718. And you can be in touch with our district director, whose name is Jennifer Lamb, L-A-M-B. And Jennifer will get you to the appropriate caseworker and give us all the information. We will make the calls on your behalf and find out why it is that you are not getting your paid medical leave, okay? So you got the number, 203.
Yes.
562-3718. And if you want to text me or put something, leave us a message. If you leave your name again, address, and your phone number, that way we will have that and you have our number, okay?
Okay. All right. Thank you, Rosa.
Thank you, my dear. You take care.
All right. Thank you.
Up next, one of our participants that are joining us online this evening, Sherry, has a question. Sherry's question, if you find errors on your monthly Medicare statement, who do you actually contact? Your insurance company or Medicare? And by the way, Sherry has a Medicare Advantage plan with Anthem.
I'm going to ask both Judy and Sean to comment.
This is Judy. Sean, do you want to go first? Go ahead.
Go ahead, Sean.
I can take this one first. If you want to,
Sure.
For the call,
No,
you can
absolutely
call our office. We'd be happy to assist in assessing the error itself, the source of the error, whether that particular error requires something in the nature of a formal appeal to try to correct it, or if the error involves some other channel of communication with the insurance company or with the Center for Medicare and Medicaid Services itself. We can figure out which pathway is necessary to troubleshoot that particular error. So you're welcome to call our office. I suspect that Judy might have a similar answer, reaching out to the Center for Medicare Advocacy as well. But use that number that I provided earlier, or email us, or get a hold of us through our website. There's an intake form on our website as well.
Okay.
Judy?
Judy?
Yeah, that seems fine. If you're certain it's an error and you know it was a doctor that might be able to, you're clear it's an error, you can always try to get in touch with the provider, see if will help you. Contact the Medicare Advantage plan and inform them that it's an error. Otherwise, definitely call the healthcare advocate or our office to get assistance to see what to do.
I just want to make a comment here. Sometimes you get very frustrated, and I just say this to our audience because you see errors and you may call and you don't get an answer and so forth. I want to tell you that be persistent. Be persistent. This is about you. It's about your health care. It's about your money, etc. Utilize the resources that are out there. And I know sometimes bureaucracy can be just so frustrating. But I also have to say to you, my mom taught me two things. She taught me many things, but my two principles are don't take no for an answer and never give up. And that's what you have to do in pursuing these efforts where there could be errors. Okay?
Thank you, Congresswoman. Our next call comes from Wallingford. We have Cheryl on the line. Hi, Cheryl. Thank you for joining us.
Hi. My question, and I'm sure it's not just myself, it's almost everybody that's on Medicare. You get a prescription, your doctor doesn't fill it. You go to get it, go to pick it up or see what the price is, and it winds up being over $100 and something. And we're talking about, in this case, just happened recent to me, is like a nose spray, which is like, if you've ever seen, it's like about a tablespoon worth of liquid. And the two drugs that were in it that were combined into one. So I called the pharmacy to go to check it out, and they told me the reason why. So I got in touch with my doctor and said, they picked these tiers for these drugs to be in, and then we're at mercy at this. We don't even know it until the doctor calls it in. And then, so my doctor, I told him, I said, it has to be something tier 1, tier 2 to be affordable, because I said $1,200 for nose spray a year is kind of like over the top, especially that's probably not even 8 ounces of fluid for an entire year. So he goes to order the medication, and it was split. One, instead of the two drugs being combined, they made them separate. So one drug wound up being $11 and change, and it was tier 2, and the other one, I guess it's a tier 3. They said they haven't gotten it yet. I've been waiting for a week. Is over $58, and I'm like, is the government or going to somebody look at providing more fairness about the cost of prescriptions? And when your doctor prescribes you medication, I called and said to the pharmacy, well, what's the generic? And they told me, well, that is the generic. My husband and I are on every generic drug that they have. Our doctor might prescribe one drug, but when it gets to the pharmacy, that's what we get, and for us to afford it. And in some cases, for instance, one of the drugs that they prescribed separate, I asked the doctor, what they did, then the choices are, and I said, well, then I'll just take the one that takes care of the infection. I'm not going to use the other one, just like the other caller did. We're looking at not being able to afford or feel that we can afford that kind of cost on medication. And my husband's on Xarelto, and he's got the same problem. And we're talking about hundreds of dollars. I'm talking about to get just a month's worth of supply. So, and I know other countries don't pay what we pay. I mean, I've read about studies and stuff where they've looked at it, and other countries will say, I'm not paying that, and this is all I'm paying. But the American public are being pressed to the wall, and this financially, with this market and the economy, is just insane.
Oh, my God. Let me just tell you that you struck a nerve with me. I've been fighting with pharmaceutical companies for I don't know how many years. And your point about Europe, the drugs that are such high prices here are, at, very low prices in Europe. Now, I will say the following, and I'm going to make a couple of comments here. We did move forward to dealing with 10 Medicare Part D drugs have been selected for negotiated price. And that will be for 2026. And these are drugs that are used to treat cancer, diabetes, blood clots, heart failure, psoriasis, rheumatoid arthritis. For me, I fought but did not succeed. I fought with others like Congressman Lloyd Doggett of Texas, etc. That why were we not dealing with all of these drugs rather than just 10 drugs? And the drugs are, for instance, Eliquis, Enbrel, Farxiga, Entresto, Imbruvica, Januvia, Jardiance, Stelara, Xarelto, and I think there's one more. But I believe this should apply to all drugs. I must say, in all honesty, the pharmaceutical lobby is one of the most powerful lobbies in the nation. It has been. We were finally able to talk about negotiating price, which took us years because of the strength of the lobby. There will be 10 more drugs in 2027 and after that. From my point of view, it's taking too long. These people should be right now doing something by bringing down the cost of prescription drugs. And in many instances, give me a second here, because the federal government oftentimes pays for the research that allow these drugs to come to market. Now, there can be cooperative partnerships, but there is a lot of research that's done by the National Institutes of Health that, in cooperation with the drug companies, to bring the drug to market. We need to have much more control over this process. I agree with you. I wish I could tell you tonight that, all of these high-priced drugs are we need to do something about. And my very last point to you is, this is a personal point. I was diagnosed with ovarian cancer some 30 years ago. And by the grace of God and biomedical research, I'm alive today. My family could afford to pay for the care and the treatment, the drugs that I needed to have. That is not the case for so many people. And I say, what good is the discovery if people cannot get access to the drugs that can save their lives? This is about saving people's lives. We need to continue to press the pharmaceutical industry to the wall on these issues to drive down the cost of prescription drugs. So, and I'm going to ask Judy, Sean, Judy, to say something if you care to.
Thank you, Rosa, for being a champion for so long for negotiating drug prices, among other things. We, too, at the Center for Medicare Advocacy have been appalled since Medicare first began to cover prescription drugs in 2006 that there was no limit to what the drug companies could charge the federal government. And they've had many, many years now, over a decade, to take full advantage of the inability, the prohibition on negotiating drug prices. I'm extraordinarily grateful for your leadership and the fact that we have broken through that logjam and will begin to make this a more sane, hopefully affordable system where the sky is not the limit. And we will be negotiating on behalf of all 65 million Medicare beneficiaries for 10 drugs at a time, but they're important drugs, and it's a major break in getting fairness and cost sense into the system. So thank you.
Sean, did you want to touch on that?
And I won't speak long because the Congresswoman and Judy both highlighted all the excellent points that I was hoping to convey as well. But drug costs are, as we heard at the outset of this town hall, drug costs are along with hospital costs, drug costs are even greater. They're the primary driver of increases in the cost of health insurance and healthcare overall. And so this negotiation is a very, very important step, not just for Medicare, but also there will be some byproducts, some side effects in the way that drug prices impact commercial insurance as well as a result of this. So we're looking forward to those negotiations and their downstream impacts going forward.
Thank you, Sean. We have time for one more question this evening. Let's go to Leslie, who's joining us via telephone. Hi, Leslie. Thank you for joining us tonight. You're live with the Congresswoman.
Thank you, and I appreciate the opportunity to express my concern. I also need to tell you I have campaigned vigorously for you, Rosa DeLauro, and I am proud that you have been as successful and such a great leader for us. Thank you. With that, With that, I'd like to express a concern, which is probably 180 from what we've been talking about, at least, maybe 360. But anyway, I am actually a healthcare provider, and my largest concern at this point, and I hope I speak for my colleagues as well, which I believe I am, is in time that we are allotted per Medicare and Medicaid guidelines to actually provide direct skilled care to our patients. What I'm asking about specifically is the amount of time that it takes, you ready for the big word, to document all of our efforts versus the time we are really allowed, of course, through our companies, to give skilled care to our patients. Time that I believe, I feel at least, the pressure of limitation for, and would really advocate for the ability to streamline documentation, such as the documentation I've observed in Canada with socialized medicine, which absolutely is to the advantage of the patient. So what I guess I'm asking is, I'm sure you have all heard this complaint before, but truthfully speaking, is there any proposed legislation to change the superfluous amounts of documentation that are required for patients? And I'm not saying that we shouldn't have it, because of course we should. And as interdisciplinary members of teams, it's obviously a very necessary item. But is there any way anyone has considered minimalizing the abundance of repetition so that we can be allowed to actually give more direct care to our patients?
Thank you. Thanks so much for the question. And I want to be upfront and honest with you. First of all, thank you for your kind words, and thank you for your help. Much, much appreciated. I do not know of any legislation that is addressing the specific issue that you have raised. However, I will say to you the following, and I would ask Sean and would ask Judy, I would love to work with you all to address this issue, to see if there is a way in which we can look at streamlining what would be helpful, and I have no problem dealing with, we can introduce legislation. Need to know precisely what we're talking about, what the opportunities are. I will look to see if there is anything that's out there already. I don't know of anything at the moment, but I am more than happy to try to pursue what it is that might be done. I just as an aside, this had to do with the Social Security Administration. I had a go-round with the Social Security Administration on behalf of a constituent where they made the error. The person had to get all the information to the long and the short of it. The frustration with the cumbersome process is so frustrating to people and puts people at risk, if you will. So I'm saying to you, and I'll ask Sean and Judy, if we think there's a way to address this issue, and I would be more than happy to work with you to see what might be done.
I'll go ahead and jump in first here. Thank you. And with respect to documentation, the providers there's all sorts of things that they need to document, not just the care that they provided in the medical chart, but in a lot of cases, and this is one of the things that we deal with, it's not just Medicare, but it's also commercial insurance, dealing with all of the prior approval, prior authorization processes that providers have to deal with, and that's a burdensome process. That's a process that causes unnecessary delays in care for somebody who may need an MRI quickly, or may need a particular procedure to be done quickly, or a medication to be delivered quickly, and it can delay the care. And there have been studies that have been published, some fairly recently, that explain that our system, these processes, these paperwork processes, add billions of dollars in costs to the system, because hospitals and other large providers have entire staffs that they hire just to deal with prior authorizations and helping them appeal denials of prior authorizations so that patients can get covered for these services. And that's one of the things, again, that our office deals with is addressing those denials and trying to get those overturned. But again, it causes, even if we're successful, there's that delay in care that occurs, and it happens just at the time when somebody's not well, and most people don't understand the process for that appeal, don't know how to navigate it, don't know the words to use and the format to use and who to contact. And so that's why our office is here to assist with those processes. But there are ways that, at least at the state level in Connecticut, that we have proposed to try to streamline some of these prior authorization processes and even eliminate them in some circumstances, just to make it easier on patients especially, but also on the providers who are trying to provide care, as opposed to just trying to bill for unnecessary services.
Judy, do you want to say something?
Yeah, I would just say I'm not sure this is such a pro and con. There's way too much unnecessary documentation required when insurance companies, including Medicare Advantage plans, do not frankly want to cover the care. And that goes to the prior authorization issue that Sean just spoke to. Also, private insurance does the same. Medicare also has way too many audits and requires documentation, which has already been provided sometimes. On the other hand, when we go to appeal a case and try and help an individual get Medicare coverage, we have to be able to see in the record that the services have been provided and an explanation as why they were necessary. It should be done as necessary to document care that was needed and was provided, not to harass providers and make them stop giving care. But there isn't a certain amount of time that Medicare requires be provided for documentation.
And Judy, I would just say, thank you both. And I would love to talk to you more about that. In a bill that I introduced a number of years ago, which was called Medicare for America, that, and what we put in that bill was to end prior
fabulous bill.
Thank you. One of these days we'll, take it out and look at it and see how we can update it and so forth. But maybe on this piece and so forth, we can try to pursue something and be responsive to our questioner tonight. So thank you.
Congresswoman, we're going to take one more call this evening. This one's from Corey. Hi, Corey. Appreciate you joining us tonight. What's your question for the Congresswoman or our guest speakers?
Okay. Hello, Ms. DeLauro. How you doing?
Hi.
I always say my family's always been a huge supporter of you, and always appreciate when you stop by our church and talk to our congregation. My question is about basically, I've been for a long time I've been having problems with medical insurance. I don't always go through my employment because of how much they would probably take out, but when I would pay out of pocket, I mean, it would always be well, I guess what I'm trying to find is I'm not trying to find a perfect medical insurance, but something that I can live with. I mean, right now I can only see a doctor 2 times out of the year. My prescriptions are if I had a prescription I need to fill, I would probably have to find a pharmacy that would be able to work with me or use GoodRx or something like that. Or and not to mention, I've tried for a long time I've the 1-800 numbers to try to find a medical insurance that for Connecticut, but every time they say there are none or they're really small and non-existent. I was wondering, is there anything any place I could go or find the kind of
Listen, let me just say, yeah, and we've got someone on the phone who can help you out there. And Sean, why don't you, tell our speaker. First of all, let me just tell you thank you. Thank you for your kind words. Thank you to you and your family for your help. It is much, much appreciated. But I think let me connect you through with Sean to see how we can give you a hand in getting something that deals with your set of circumstances. Mm-hmm.
Yeah, my response, thank you, Congresswoman. My response would be, Corey, please call our office. One of our case managers can work with you to drill down into the specifics of what your needs are, what your financial circumstances are. If there's ongoing care or if you're anticipating care throughout the year, how you can select the best health plan options that are out there. Again, if you apply for health insurance through the marketplace, Access Health, you may be eligible for subsidies to help you pay for the cost of premiums. There may be subsidies available to help you with some of the cost sharing, the deductibles and co-insurance and that sort of thing. Again, that's income dependent. If you do have insurance options available through an employer, we can help you weigh and consider those options against what's available in the marketplace. So again, we probably can't solve your individual problem here during this town hall, but I strongly recommend you get a hold of our office and somebody can work with you to help you find the best option for your precise situation.
Thank you, Sean. I just want to say this, and Corey, thank you, but I want to just say to our audience out there, with both Sean and with Judy, these are tremendous resources. The center and the Office of Advocacy, and one of the reasons why I wanted to do this town hall tonight on this topic was because some of the issues, they're so individual. Everybody has a different set of circumstances around these issues and different needs. So you have very meticulous, caring resources that are available. And I want you to take advantage. Obviously, you can call our office anytime. We're there and accessible. But, some of the detailed nuances of your own concerns can get answered by, Judy Stein or by Sean King. And as I'll include our office as well. But please, make use of these excellent resources. Your health care and your family's health care is critical. And we realize that, and we want to make it affordable, we want to make it accessible, and we want to be able to have you meet your health care needs.
Thank you, Congresswoman. And
Thank
unfortunately,
you.
That's all the time we have for questions this evening, but we appreciate the opportunity to speak directly with you to answer your questions. But if we were unable to answer your specific question this evening, you can contact us through our website. That's deloro.house.gov, or you can simply leave a voicemail after the event by remaining on the line. We will host more of the events in the future to keep you informed on what we're working on and other important updates. And Congresswoman Rosa DeLauro, always a pleasure moderating these for you. Any final comments you'd like to add this evening?
I